I think that in general it's about fit. So if you meet me or you meet Dr. Johnson, do you feel comfortable with us taking care of you and your family? As he mentioned, it's a marathon, not a sprint. And for many of these patients, this is a 9 to 12-month journey between diagnosis and chemotherapy and surgery and more chemotherapy. And so we end up playing a pivotal role in addition to the medical oncologists in sort of quarterbacking these maneuvers and coordinating closely. So it has to be someone that you trust. And we often meet, especially in the pandemic with video visits, people have been meeting, multiple programs, which is certainly, a very reasonable thing to do because it's a big investment of your time and your health and your future. And so I think it's important for FIT to be there because obviously if everything works out and you're cured, great, and you'll be delighted almost no matter where you go. But obviously many of these diseases can be difficult to treat and can be long processes. And so it's critical that you trust your team and you feel comfortable. I think experience is another factor that's very important. And that's one of the parts about this program that I know Dr. Johnson and I are both very proud is how much we've grown over the last few years. And we have the capacity and continue to have the capacity to take care of these complex patients. He and I have wonderful residents and fellows and other folks that help us in the operating room and other services, as well as each other. And that's allowed us to push the limits. And so experience matters, and experience with complex cases matters. And then lastly is what we mentioned at the beginning of this program, which is about the milieu in which a program resides. And I think that there are lots of programs that have experienced surgeons with whom you are comfortable, absolutely, in this area as well as across the country. But it is hard to find a place that is a full service institution for all of your needs, whether it's medical oncology expertise, cardiology, anesthesia, et cetera. And so again, God forbid there's an issue, there's probably no place I'd rather be as a patient than here. And so I think when you're looking at programs, it's fit, whether you like the people, experience, and of course the milieu or context in which the program resides.